Hello, this is Siddharth Tambar from Chicago Arthritis and Regenerative Medicine. This is Friday, March 13th, 2020. It's interesting, my office is located here in downtown Chicago, and it's a beautiful day outside. It's unseasonably warm, a lot of sun. It's actually quite a beautiful day given the time of year. And yet the streets are dramatically less crowded, less people out, just a lot of people avoiding work and really going outside. And it's interesting because it reminds me of probably one of the first nights I was on call as an intern during my residency training, where you're sitting around, and I'm sitting around and looking around, and you really only see other interns, a few residents, and then the nurses that are on the night shift. And it occurs to you at some point that you're really the only people there as a line of defense for the people that you're taking care of. And it's a really deeply profound moment when you realize that the difference between the people you're responsible for in terms of life or death or a good outcome is how hard do you work, how conscientious you are, and how dedicated you are. And that gets really drilled into you as part of medical training, that you are the line of defense for humanity. And it's a powerful concept that you learn really implicitly through every single day of your training, but especially in those moments where you're really there all by yourself with a few key other team members in the middle of the night. And so on a day like this, where you realize that the city is really just almost emptying out and people just sort of bunkering in because they're scared, they're concerned, they don't know what's happening, and because there's a significant lack of leadership at the highest levels, with a few exceptions, that here on the ground level, as a physician, we're still the last line of defense. We're still the last line of support for a lot of people who need our help. And thinking about it, I need to have a conversation with my own team at work that you have to make decisions for your own health and your own family's health that makes sense to you based on your values and what you think is best. But as for me, I'm here basically to hold it down, do whatever I can do to help the people who trust me with their care. I am here till the bitter end. And that, at its very core and essence, is what I think is most decent and ethical about what physicians are about and supposed to do. And seeing some of the dedication and consequences that physicians and nurses have had in other parts of the world, especially in China, is really deeply moving and frankly inspiring to really be there and available for the people who trust us with their life, their livelihood, and everything. Really trust us with everything. So I hope everyone is staying safe, and have a good day and live well. Bye-bye.